to the Vital Living Forum. I'm Jeff Johnson with AARP. Florida has the nation's largest percentage of older residents, so as a state we need to prepare for what this means now and in the future. In 2019, 4 organizations created the Coalition for Silver Solutions to create a blueprint for the future of long-term care for seniors in our state. And that's the subject for today's Vital Living Forum. Joining me today are Coalition members Deborah Franklin of the Florida Healthcare Association, Nick Vanderlinden of Leading Age Florida, and Dale Ewert of 1199 SEIU United Healthcare Workers East Florida. Welcome. So let's get started. Can you talk a little bit about some of the challenges that Florida faces as we look at the needs of our growing older population?
Yeah, thank you, Jeff, and happy to be here with everyone today. To kind of put things into perspective, you've got a city roughly the size of St. Petersburg moving into Florida each year, half of which are 60 years or older. So that naturally puts a strain on the systems that are currently in place. So the good news is that Americans are living longer, but the challenges that come with that are the increase in acuity. So the seniors that are in nursing homes today need an increased level of care, and nursing homes are having to provide that extra level of care. So with that increased level of acuity comes increased need for resources as well. Yeah, and workforce is another one of those challenges.
So you all work in this sector, in this world. Just as Nick was saying, you're seeing more and sicker or frailer patients, residents. How is that what we're talking about here?
Jeff, the continuum has changed as Florida has aged. When I began working in this profession almost 35 years ago, the type of resident patient that you would see in the skilled nursing facility then is now in our assisted living facilities. And you have more home and community-based services also providing to help keep people in the home longer. And then the skilled nursing, which used to be strictly like long-term care, you went there to die, as you've heard people say, has totally evolved to now it does 60% rehab to get people back out into the community. And it is the higher acuity that can't be done in the home and community-based or the assisted living that is now in the skilled nursing facility. The really high acute that when I began in this profession was still in the hospital.
Oh, interesting. So, yeah, go ahead, Dale.
When you talk to some of our members who've worked in nursing homes 20, 30 years, some of them, they'll tell you about the times when they started working, when there was time to sit at the bed, hold the resident's hand, have a conversation, and because of the changing nature that you both described, that experience both for the residents as well as for the staff has really changed dramatically, and it's created great challenges for the workforce.
Yes.
So when you think about these challenges, is that what sparked this coalition? Where did this come from, and why is there this Coalition for Silver Solutions?
Well, it's usually in adversity where we're squeezed to come out with something better. And that's what we're seeing now with this, there's 10,000 baby boomers retiring daily. And many of those are retiring to Florida. And so when we see the projections, the census projections and where we're going, we're already feeling workforce challenges now. And so what is gonna happen as we continue to see those baby boomers needing that care, and we need to do something, the shot in the arm, to help boost our workforce, to make sure we've got school programs and things going to continue to grow the workforce, because we're already feeling the strain on the lack of workforce.
And obviously our organizations come at this from different perspectives, and we don't always see the world in the same way or even see the problems in the same way, but I think we realize that on the major issues that face the state and our aging population, we tend to agree more than disagree, and we're going to be more effective in moving a policy agenda if we're talking to each other and working together than if we're each going our separate ways and fighting each other.
Right.
Yeah, and what we're seeing as well is there's a lot of short-term solutions that we keep, trying to put a Band-Aid on the wall. So we came together realizing that we needed to really develop a comprehensive blueprint for Florida moving forward to make sure that we continue to provide the highest level of quality care for our elders, which is currently happening.
Good, good. Yeah, and we're going to talk about that blueprint in a minute. But before we do, just want to make sure, I know a lot of times when we talk with people who are taking care of like an aging parent or a spouse, there's a lot of confusion about what long-term care is. A lot of times people conflate long-term care with long-term care insurance or with simply nursing homes or with acute care or health care. So can you help kind of tease out what the needs are that this system is meant to address?
Sure. There's home and community based, and so you may have someone that is receiving some care in the home, and then as the needs get worse, or maybe they fall and fracture a hip, they might need rehab. The rehab is to rehab and get you back to home. But then there are certain diagnoses, comorbidities that maybe the acuity level is so high that you need long-term care. It might be that you have some memory issues and you're not safe to be alone anymore. You do not have caregivers that can help you support. So assisted living is a great aspect. There's some wonderful memory support systems in assisted living. And then also there's long-term care in skilled nursing. That would be, you could be in stage something, or it could be just a lot of comorbidities that require 24/7 skilled nursing care for long-term care.
It's a good question. I think it's important that when we think about long-term care, we do acknowledge that it's a continuum and it's lots of things, and not just focus on one segment of it. In particular, home and community-based care needs a lot more attention than I think it gets.
Yeah, that's a good point. I think people know what they do taking care of a loved one, a parent or friend, and they know what happens in facilities. Maybe they don't realize that there's also a part of this system that helps take care of people at home. Is that true? Or do you find people who didn't realize that there were home and community-based options, or is it just that we're not keeping up with that need?
With the increase in rehab, that's where the social workers get to meet with the family and talk about, like say it's a fractured hip and fell in the garden and fractured the hip. Now we've got your rehab to home, but the family said, we've noticed mom declining. She can go back home, but not like it was. We need to add some services. And so that's where the social worker will step in and say, these are all the services available. And that's the goal, is to get them in the home as long as possible, to add some of those home and community-based services, whether it's Meals on Wheels or someone that will come in and just help tidy up the house, or it might be just a caregiver a couple of days a week to come in and help with some of the personal care, and that will help them to be able to stay in the home longer.
I think that's a struggle too that we're currently seeing. We could do a better job of communicating and further strengthening and developing the local aging services network.
Yes.
There's a number of services available in each city that a lot of people just don't know about. So I think a coalition could really serve as a vehicle as well to better spread the knowledge of those services available, so providers can do a better job of making sure that everyone's taken care of.
So real quick, let's talk about that blueprint. What exactly is it? What's in it? What's the plan to further develop a blueprint for the future of this important part of our community?
Well, we have some recommendations for the legislature for this upcoming session that address some immediate needs that we believe are both necessary but also politically feasible in the short term. And while we do that, we're going to continue to work on a long-term blueprint because Florida's problems can't be solved in a single legislative session. And there's a lot of work that needs to be done. And so while we proceed on the short term, we're going to be thinking big and long term and hope to provide that blueprint in the coming year.
I think a key part of that as well is educating the legislators because it's very tough for someone to really, unless you have a significant other that's, or a spouse or a parent that's in one of these settings, it's very tough to get that picture. And especially with the turnover in the legislature, it's important to provide that education. So we're currently working to educate on some of the short-term needs already, adequate funding for nursing homes and home and community-based services, and we're developing long-term strategies as well, and then making sure we tie the short-term strategies to the long-term strategies to make sure that they get the picture that, hey, this is all part of a larger picture to make sure that Florida's in a good place to continue to provide high quality care.
And we're going to get back to that, but we have to take a quick break. So hold that thought and we'll come right back to it. This has been a great start to the discussion about the Coalition for Silver Solutions. And in our next segment, we're going to talk more about the blueprint and how we move forward and the challenges that elder services providers face trying to provide skilled nursing care. Thank you for watching the Vital Living Forum. Welcome back to the Vital Living Forum. I'm Jeff Johnson from AARP, and we're talking about the Coalition for Silver Solutions and how we're working to build great communities for seniors and disabled adults and their families. So in the second segment, let's get to the challenges that affect long-term care providers and their ability to provide services. My guests are Deborah Franklin, Nick Vanderlinden, and Dale Ewert. Let's go ahead and get started. So let's just break it down a little bit. What are the different levels of care in Florida, and what sorts of professional caregivers are providing that care?
Yeah, we like to talk about a continuum of care for aging services. And when we talk about a continuum, we start all the way with affordable housing for low-income seniors, assisted living facilities, memory care, nursing homes, continuing care, retirement communities. And when you're talking healthcare professionals, you're talking, the entire gamut as well, from service coordinators to physicians, CNAs, LPNs, and more.
And are there paid caregivers at a variety of levels in each of those settings, or is it kind of depend in a home setting versus, say, in a skilled nursing facility, nursing home?
Well, each type entity sometimes has regulations that you're required to have, like a certified nursing assistant, to do the ADL care in a skilled nursing facility, where an assisted living, you can actually do the hands-on training for a resident assistant, and home and community. Base services also have where the company does some training and they can be a personal caregiver.
Great, and just a quick question for me. You mentioned ADLs. I know that term gets used a lot. What are those?
Activities of daily living.
Okay, so the things like walking around, getting up, going to the bathroom, feeding yourself, those sorts of things?
Correct. It's
Okay.
whatever that resident needs assistance with to meet their activities of daily living.
So it sounds like it's a pretty complex network to deal with people with different needs, right? What do we need to do to strengthen that network?
Well, the first thing is to recognize that we have the tsunami coming, the aging wave. In addition to the baby boomers growing, we have baby boomers that will be retiring from the workforce. So it's a kind of a double whammy that we have to recognize.
Yeah, so from a workforce perspective, we think about the potential people who are going to be customers, residents, patients, but it's also a challenge for you on the workforce side too. Are there a lot of your members who are going to be leaving the workforce in the next few years?
So the workforce challenges in long-term care are enormous. This is low-paid work for really for most of those who provide the hands-on care, the certified nursing assistants, many of whom as healthcare workers don't have affordable health care for themselves and don't have retirement. And for the wages that most nursing homes are able to pay under the reimbursement systems, people can go work at Walmart or in the service industry. This is emotionally draining work. It's physically demanding work. And we can't solve the problems of our aging population unless we solve the problems of the workforce. Because no matter how much money we put into the system, if there aren't people there who are able and willing to provide the care, and I think we also have to recognize there's an element of it, you talk about paid care, we also, I think, have to address the unpaid caregivers, family members, friends who are providing care, and think about their needs as well, because I think that's going to be an important part, is and will continue to be an important part of the network of care for all of us as we get older.
It's a really good point. And I know we talked earlier about how a lot of, for instance, skilled nursing facilities are doing rehab and then sending people back to home. Are there things that we already do or maybe should do to help those who are paid to provide care, train those who are family members who are likely going to take care of the same people when they go back home? Is that something that already happens in facilities or something that we should be looking to do more of?
Well, that's why, and for someone that has made it into rehab, the social service, the entire disciplinary team, the therapist that has did rehab for the resident will meet in a care plan meeting and discuss what needs to be done so that that resident will be successful in the home, whether it's some training, whether it's the additional services for home and community-based, whatever's needed for that resident to maintain some their independence as long as possible.
Great. Now, in terms of how we change things, I know you mentioned that one of the challenges is wages, and a lot of, as I understand it, a lot of the reimbursements that you get are through, the facilities get are through Medicare, Medicaid, VA. Would raising those reimbursement rates at the federal level be part of the solution that we would want to look at?
Well, the federal and the state level, Medicaid is a high population in the skilled nursing facilities. And currently, the skilled nursing facilities lose $27.75 per patient day.
Wow.
That amounts to about $675,000 per facility.
Wow.
For the year. And when your margins are less than 2%, that's not sustainable. And across the nation, we have seen skilled nursing facilities close at record numbers. And that's why it's important that we take a look and do this collaboration that we're doing so that Florida can continue to be sustainable in all of the senior services that are going to be needed for the aging population.
Yeah, sorry. When you're looking at 90% occupancy in nursing homes in 2018, 63% of that was Medicaid. With the inadequate reimbursement system, it's very tough to keep these people working there, especially as you mentioned, they can go to the fast food industry for $1 or $2 more an hour for a lot less demanding work. So it's very tough to recruit and retain that staff.
The truth is that caregivers are subsidizing the long-term care system by working for poverty level wages. And it is unacceptable that our seniors should be given care on the basis of other people living in poverty. It's not sustainable, and it's wrong.
Yeah. So how do you explain all this to legislators and the policymakers who really set this out? I know one thing that from AARP's perspective I've learned over time is virtually nobody runs for state legislature because they want to talk about Medicaid long-term care. Not that they don't care about it, and many of them have personal caregiving stories, but there are other issues that tend to get more of the spotlight most of the time. So how does this coalition change that and educate the people who are elected to office about their role in this?
Obviously, there are hurdles anytime you're talking to legislators about spending more money. But one of the advantages we have is that we all have parents, and we all have grandparents, and we all anticipate getting old someday ourselves. And so there is the possibility of creating bipartisan coalitions around healthcare that may not exist in other situations. You can often talk to a legislator whose political views may not match your own, but bond and relate over a common experience of having a parent or a grandparent in a nursing home and understanding what that is like. And we have found that to be a very effective way of communicating with legislators on long-term care issues.
Been your experience as well?
Yes.
And is there a component too of explaining what goes into operating a facility, like the other challenges that you all face, not only the workforce challenges and the changing nature of the population, but I presume there are a host of other issues that are make it difficult to keep facilities up and running at a high level?
A lot of it's education that they, I think they assume that we can charge a certain rate. They don't realize the actual statistics of the numbers of Medicare and Medicaid, that those rates are set and that is your revenue source, that's where you're at. And when you educate on that, it kind of gets an attention that we do have to take some time here and look at this, but there definitely is a large amount of education that has to be done.
Go ahead.
One of the things that we found very effective is what we call work a day. We ask a legislator to spend a day working with one of our members in a nursing home. And it's just amazing the impact that has on that member's perception of the work that nursing home workers do and of the challenges they face.
Yeah.
Yeah, something similar. We ask our members to invite legislators to come over and tour the facility, just so that they can really get a look firsthand to see who it is, that their decisions are affecting, and how things really operate at those.
Fantastic. Well, thank you for that update, and thank you for the helping to explain this really complicated system. Dale, Nick, Deborah, appreciate it. We'll be back for one more segment in just a second. This is the Vital Living Forum, and we're going to, in our next segment, discuss future legislative issues for the Coalition for Silver Solutions. Welcome to the Vital Living Forum on long-term care in Florida. I'm Jeff Johnson from AARP, and in this segment, we'll discuss the Coalition for Silver Solutions ideas to help improve Florida's long-term care system. My guests are Deborah Franklin of Florida Healthcare, Nick Vanderlinden of Leading Age Florida, and Dale Ewert of 1199 SEIU. So let's get started. What are some of the key areas of the Coalition's work? What is the focus of this group?
The very first thing was for us all to come together, and that was huge. Many times these different groups have been on opposite sides fighting for money, and we recognize it's going to take all of us to meet the aging population in Florida's needs. And so we came together and discussed the issues that we're individually facing to see how we could collaborate together to come up with solutions.
Right.
Yeah, adequate nursing home funding would definitely be one of them as well.
And as we discussed earlier, looking at the entire continuum of long-term care, not just residential care and nursing homes, but dealing with the waiting list for home and community-based services, making sure there's adequate funding to provide space for the people who currently need it, as well as down the road, the people who are going to need it in the future.
So yeah, I understood that part of the discussion was about how we ask the legislature to sort of increase gradually what the Medicaid reimbursement rate is to try to support the growth of the network and the needs to take care of more people. I think they talk about a percentage over inflation or something like that. Can you speak more to that?
As I mentioned, there was $27.25 per day loss. That's because we are operating in 2016 rates. Well, we've had to continue to give raises, cost of living increases, and we're still at, as Dale said, a low rate because of the reimbursement. And so we're asking that inflation be put into the reimbursement so that we will continue to get those inflation increases so that we can pass that on to the workforce.
Great. Now, and I think a lot of people assume that long-term care is paid for by Medicare, which, as we've said earlier, other than rehabilitation, kind of short-term stays, it's not. Medicaid tends to be the primary payer. Correct. And then a lot of people don't realize that Medicaid is hard to qualify for. So are there any changes out there that would make it easier for people who clearly need care and can't afford to pay out of pocket to more easily qualify for Medicaid long-term care?
Yeah, what we're currently looking at as well is Medicaid eligibility for people with whole life insurance policies. Persons with whole life insurance policies currently don't qualify for Medicaid eligibility. So to give them that eligibility would save them money for long-term care services, and it would save the state money in the end as well, because they would be able to get that money back from their life insurance policy.
And then from the workforce perspective, we spoke in an earlier segment about how difficult it is to attract and keep really good staff. How do we change that? How do we get better at recruiting and retaining people who have not only a passion for this, but can afford, frankly, to work these jobs?
That's right. I mean, it's going to take an investment in the long-term care system. We need stable jobs that pay a living wage, that provide health insurance and retirement. And that can't be done cheaply. And so we have to take a good hard look at what the costs and what the expected need is going to be and fund it. And again, also keep in mind that we have another set of caregivers in the community and in the homes, and their concerns and needs need to be addressed as well.
Yeah, so I just want to follow up on that, because it seems to me that as we think about this, as you've said before, very physically and emotionally demanding job, one of the groups of people I would think would be a good place to go for recruits are people who have been caregivers in their personal lives, that you might find people, in fact, I know people who have taken care of a mom or a dad and realize this is meaningful work. Is there a way that we can try to kind of elevate that and maybe try to attract more of those family caregivers into the workforce?
We're currently doing that. We're trying to work with universities, colleges. We're working with the CNA schools to help them get the clinicals into the facilities. We are partnering with HOSA, Health Occupation Sciences of America. It's the high school and junior high kids to say, look at us. This is a gratifying career that you can have where it's not just a paycheck. You can impact lives. And we're trying to hit at different ages to make people aware of this wonderful profession where you can have just a job or you can make an impact in people's lives.
Deborah's so right. We talk about how difficult the job is emotionally and physically and how it's not particularly well compensated. But the fact is there are people who spend their whole careers, 20 and 30 years, by the bedside giving care. It is an incredibly rewarding job. And if we can match the satisfaction of doing the job with decent pay and benefit levels, I think that would go a long way towards solving the workforce problem that we have.
Yeah, that makes sense. So now, as people have been watching this show at home, how can people find out more about the coalition? How can they get involved? Is there a role for the folks who are watching this program to have a voice and play in this?
Yeah, absolutely. Reach out to your local legislators and tell them about what you've heard here today. Help educate them that these issues exist. They affect not just these organizations. They don't just affect policymakers. They're going to affect Floridians all across the state. So by helping educate legislators, it will help us put us better in a position to implement our plans.
Great. And I would just add to that, it seems to me one of our barriers is people don't talk about their role as a family caregiver unless it comes up, unless somebody else raises it. We talk about when we have kids that we're raising. Everybody knows about that and has that conversation, but you can know people for years and never know that they're taking care of mom or dad. And the more we talk about it, the better it is in terms of elevating the importance of these issues. So we've got time for just final thoughts from each of you. Deborah, final thought about this coalition.
This coalition has been synergy, and together being united, we can be a voice for that 1 in 4 that in 2030 will be in Florida. And that's what everyone needs to be a voice to realize the aging that's happening in Florida, and we need to be prepared for that wonderful aging group.
Great, thanks.
Yeah, this coalition allows us to be in a better position to really identify the challenges that are currently out there, develop solutions, and help implement them. And I think the coalition is a great vehicle to help get that message out to the public and the legislators.
Okay.
I'm particularly looking forward to our discussions and deliberation on a long-term vision for the workforce, and would like to see an engaged, empowered, and adequately compensated caregiver workforce in Florida in the near future.
Great. Well, I want to thank all of you for today and for this coalition, which I think is so important and so meaningful. And I want to thank you watching at home for taking the time to learn about this. Thanks for watching this Vital Living Forum on long-term care in Florida. And we hope you've learned something about the challenges and opportunities that face frail elders and disabled adults and their families, and the organizations that provide them care.